going to say, look at the cat drug in. Ladies and gentlemen, let's welcome back the star of this show, one of the most recognized voices and faces in Pittsburgh when it comes to the overall care of your pet, from the clinic of the same name in Cranberry Township, the host of Animal General, heard every Saturday from this time until 9 on KDK, Dr. Michael Hutchinson. Good morning, Doc.
Good morning, Rob, and thank you for that introduction, and welcome back to another edition of Animal General.
Saturday morning radio fans know him as Dr. Mike, the veterinarian whose home base is a clinic in Cranberry, works his magic on a menagerie of pets.
Pretty bird? Hello. Hello. Hello.
From exotic birds to water dragons, his rapport with pet rodents earned him the national title, and I'm not making this up, Rat Vet of the Year.
Those pet rats are just really neat. They're like little dogs. They're just neat. Train them to do anything.
But a visit to the doctor's home in Barkeyville, that's right, Barkeyville, reveals his primary focus is the veterinarian's stock and trade.
Well, I have 3 dogs, and we adopted all of them, and then I have 4 cats, and that's our household right now, and I think the cats rule. Come on, Timber. Come on. Let's go out.
The Pennsylvania native returned home with his wife Beth and 5 children in 1998, leaving behind a thriving practice on Long Island. That was a matter of choice. But growing up with a father who raised beagles, it seemed his career path was preordained since childhood.
Well, my dad said to me at that age, geez, Mike, you'd make a good veterinarian. And, so my whole life, that's what I thought about, and that's what I wanted to be. And here I am. Now I'm a vet.
And I'm a little concerned about this hair loss.
Okay, is she itching at all, Mary?
A little bit, but not excessively.
Dr. Mike has been dispensing advice on Rob Pratt's radio show since 2005.
She is extremely energetic and likes to climb the drapes and jump on the kitchen and dining room tables.
Who doesn't like to do that?
Yeah, I know.
But it's not just the usual pet care advice. The vet from Cranberry has gained worldwide attention with cutting-edge surgeries in the field of regenerative medicine, regrowing damaged organs and tissue.
We did the first stem cell transplant on a bird and on a parrot.
Despite the controversy over human research, Dr. Hutchinson's work has nothing to do with embryos.
A stem cell, all it is a repair cell. It's in our bodies. We have it in our blood. We have it in different tissues, our brain, our heart muscle, our tendons. We also happen to have a tremendous amount in our fat.
Injecting stem cells into household pets, like his own dog, Babe, follows similar treatment of horses, which began in 2006.
Babe, we adopted her when she was 8 years old. She had a few problems. One of them happened to be arthritis, osteoarthritis in her hips and in her knees. And she was having trouble going up the steps. I have some pretty steep steps from my basement up to this first floor, and she couldn't go up them anymore without assistance. So I decided to give her stem cells. I didn't want to put her on drugs for the rest of her life. She's now 14, 15, and as you will see, she can go up those steps with no problem. And that's all due to the stem cells.
Sammy's a very good girl. Let me take this cone off.
Dr. Hutchinson prepares for another surgery at his Cranberry clinic as his patient hobbles into the operating room. X-rays reveal the source of her pain.
See, here's her kneecap on both sides. This is her right leg and her left leg. She's got quite a bit of arthritis in here. All this roughness should be nice and smooth. Over here, we can hardly see a joint space. Like here, you see the joint space. So we're going to give her stem cells in each of these joints, and I believe that's what's causing her pain and her limping. We just need about a tablespoon of fat.
An incision is made into Sammy's hip, and a small amount of fat is removed.
In humans, they find more stem cells in the belly fat. So they take it from the belly in most humans. Same area where a lot of people have a liposuction done. There's lots and lots of stem cells. And I think what's going to happen down the road is we're going to start seeing stem cell banks, just like we have blood banks.
The veterinary assistant slices the fat into smaller pieces and then places it in a water bath where it's further broken down to release the good cells. The vial is then placed in a centrifuge for 50 minutes, during which time the stem cells will separate. Dr. Hutchinson is the small animal spokesman for Medevat of North and South America, world leader of regenerative therapy.
Then we're going to add some growth factors that come from the platelets, and up to about 2 mLs. And we're going to, what that growth factor is going to do is help wake up these cells that are in there so that they're ready to do their job, which is repair.
He says he's performed more than 230 stem cell procedures, and in only 3 cases has he met with no improvement. But right now, his focus is on Sammy. Would she be able to resume her valuable service as a therapy dog for the Western Pennsylvania Humane Society?
This joint's really bad.
The solution is injected directly into the arthritic joint, the source of pain.
We're giving the rest of these cells intravenously, and now the cells are dripping in.
The mix of stem cells and saline solution completes the process.
These are adult stem cells. These are from Sammy's own fat, and they're going right back into her, so we don't expect anything but side benefits, no side effects. They're her own cells.
Similar treatments are currently being used on humans, again with good results. But how will Sammy fare? 1 week later, Sammy's owner, Gretchen Fieser, tests her dog's progress in the open field.
Sammy, are you ready? Come here. Come on, come back here.
Sammy appears to be more than ready. Though she still has a limp, her master says it's much less pronounced than before the surgery, just 1 week earlier.
Earlier this summer, there were days where she would chase the ball maybe once, look at me, drop it, and sit down and look sad. But she just wants to play and play. I know she'll never go back to running after my husband on a mountain bike like she did when she was a puppy, but when we talked to Dr. Mike about the stem cell treatment, we wanted her to be off of the medication, because medication in any form can be hard on the body. To be able to have a normal life where she could play ball, where she could do her therapy dog work, where she could go on hikes and not only enjoy them, but not come home and be stiff and sore and exhausted. And you can see after 1 week, she's doing absolutely fantastic.
A happy ending, or is this just the beginning?
It's something that I prayed that my children would see before they passed away, that they would see these stem cells come to fruition. And here I am doing it, and my children get to see me doing it, and it's just something I want to share with the world.
Sammy's just happy that Dr. Mike shared it with her. Regenerating, a second chance at life. I'm Dave Crawley.